I'm going to demonstrate how a process called direct intravenous ozone therapy is performed. This is a treatment that's been done in many countries around the world, and I was trained by one of the world's best intravenous ozone treatment physician, Dr. Howard Robbins in New York. He's had over 27 years of experience and has done over 260,000 cases of ozone therapy with virtually no complication. Usually if there's a complication that occurs, it's a temporary rash which resolved with time, and also with treatment with Benadryl and some oxygen. Sometimes you can get an allergic reaction like if you have a horrible bee sting, where you can get swelling as if you're going to have some swelling in your tongue and mouth and edema around the eyes. And that also responds well to intravenous Benadryl and anti-inflammatory Decadron, as well as with oxygen. So this is the demonstration of how a direct intravenous ozone treatment will be performed. The patient is in a nice supine position, sitting nice comfortably, with the legs relaxed, arms on the side, and we place a tourniquet on the arm so we can get a nice vein that comes up very nicely. Once the vein comes up very nicely, the process of getting the ozone is done directly into the office. So once I get the syringe, which is filled with medical grade oxygen and ozone, which you make into your office, it's used by filling this 60 cc syringe with the oxygen and ozone mixture, and you use a 27 gauge butterfly, which is a very tiny needle that you use that the patient can barely feel once you do the injection. So once the patient's vein is prepared, you make sure that you use very sterile technique using peroxide to clean the vein. And this is done because you want to make sure you stay sterile. Although ozone by itself can kill all bacteria, fungal, yeast, mold, parasite, spirochetes. So therefore, it's an added benefit not only using the sterile technique using peroxide. Peroxide is used because you do not want to use alcohol, because alcohol actually denatures the skin and affects the vein if you do it long-term, chronically, daily on a basis. So therefore, now the patient vein is ready, you simply use the small needle and you place it with a very quick needle stick into the vein. And once you get a flashback, you're ready to proceed by injecting the medical grade ozone. So the patient applies 4 minutes of pressure to the area where it was injected, because within about 4 minutes the vein is sealed and there's literally not even a drop of blood. Now, the medical benefit of ozone is extensive. Ozone can be used with or without conventional medicine. It can be used with any kind of pharmaceutical or natural medicines, herbal substance. So therefore, it can be used as an adjunct to add to the treatment. And this can help patients with many, many disorders. So it can help, and they call it traditional medicine or alternative medicine in the United States, but in many countries around the world, it's actually primary medicine where they use it first line. Cuba, Germany, a lot of South American countries, Italy, and many other European countries use ozone to treat all types of bacterial, viral, fungal, yeast, mold, parasite, spirochete. It even helps to chelate heavy metal toxicity out of the nervous system that normal chelation does not do. And you can use it to treat, oxygen therapy for chronic fatigue syndrome. It helps with fibromyalgia, because fibromyalgia is a chronic disorder that affects your entire system, and ozone has no respect for disease. It treats everything. So it's not a guided missile, it's like an atomic bomb that just goes through your entire system and helps you to heal. It increases stem cell production, it increases red blood cell circulation, it increases oxygenation, it increases your energy level, it helps you to sleep better, it helps hair and nail to grow longer and stronger, it helps with fatigue, it helps you get a burst of energy. And because basically what you're doing is you're trying to give a high dose of oxygen. The way I discovered medical ozone for the treatment of my chronic pain patient has to do with the literature that's just filled with so much information about using ozone around the world in many countries for the last 40 or 50 years. And it's been done very safely. It has a good track record, and it has a tremendous amount of benefit. As far as medical grade ozone is concerned, it's done in the office, and it can be very beneficial to patients. My background as a chemistry major, biology minor, triggers a lot of this reaction into my brain. When you look at the reaction of ozone, of H2O, water molecules getting another molecule to form peroxide, H2O2. When you look at carbon monoxide, CO, attaching another molecule to form carbon dioxide. There's a lot of reaction that occurs when you give ozone. And as a chemistry major, this intrigued me tremendously. And I go a step beyond. As a anesthesiologist, gas, a lot of people say gas passer. Well, this is great because ozone is a gas. It's a medical gas that you can use for purpose of helping patients with many conditions. So as an anesthesiologist, and now as a pain physician, with all the benefits of ozone as an anti-inflammatory and its pain reliever effect, it's just astonishing to me that it's just an added benefit to help my patients when I can do something not just to target their pain in certain areas, but also to target and help their pain systemic-wise, the entire body, because pain medicine is not simply something that you just inject a certain area, joint, here and there, because if you look at the root of all cause of problems is inflammation. So inflammation that affects your whole body, arthritis, tendonitis, all the itis, is all related to inflammation. So if you can target without using narcotics, without using anti-inflammatory, without using these medicines that can affect your kidneys and liver, if you can use this medical treatment, which has a very good record to help patients, I believe it's a win-win situation for everyone, especially for the patient. So you use it as an added benefit. So I put all three things together: chemistry major, anesthesiologist, gas passer, pain medicine. Ozone is a wonderful thing that I think will help lots of patients, in addition to all the other things that I do convention-wise. So I'm not going all alternative medicine. I'm using ozone to add to what I'm doing already. Just like I use other modalities such as light therapy. Because basically, if you look at the basis of life, you need three things besides everything else, of course. You need water, you need oxygen, and you need light for the cells to work. And if the cells can work with these basic nutrients, you will have a good functional cell. Cells deteriorate when they no longer have adequate oxygen, adequate light, and adequate hydration. And that's when I believe that all the disease process and inflammation occurs. So ozone is one modality, besides other things, that can help patients, not only because of the pain that I'm treating, targeting the area that is painful, but also working with them in total.